Everybody, my name is Camille. Welcome to my channel. Here I make videos about applying, getting in, and staying in medical school. I'm an incoming first-year osteopathic medical student. I wanted to come on today to talk a little bit about how I found my research opportunities, as well as how you can find research opportunities that you're actually interested in. I always tell people you do not have to do lab bench research to get into medical school. I didn't have lab bench research, and although it is something that interests a lot of people, it didn't interest me. So I wanted to come on here and show you that there are different things that you can do to get research experience. So with that being said, let's talk about some of my tips to find research opportunities. First, you want to review your past experience. What have you done? What have you enjoyed? Did you really enjoy volunteering at a hospice center? Did you like teaching younger students about science? What within your past experience did you find interesting? So I would talk to fraternities, sororities, first-year dorms about sexual health as well as alcohol and other drugs. It was a lot of awareness, education, and prevention strategies that I would help facilitate in these basically big group settings. And I realized that I loved health education, but I wanted something that was more personal, so I also got that feel, and I became a certified HIV counselor and tester for my state. And there I learned a little bit more about the intricacies of talking about someone's personal health, and it didn't just have to be about their health and what they were consuming, and it was about more things. It was about their social group. It was about how they view themselves. It's how they self-identify. There was a lot of things that I saw that I thought were fascinating, and I was only able to get that when I did realize that, hey, I had this one experience, but I wanted to then see that experience in a different light, in a different position. So again, look back at your past experience and see some things that you might have liked, some of the things that you might not have liked, whether you do need to search for a position where you do get paid, because sometimes people do have financial constraints. And I also can make a whole entire video about how we should be paid for a lot of the work that we intern or do for free, but that's beside the point. I wanted to just talk to you guys about So with that being said, it's important to see what you do like and then go from there. Next, you want to start looking for an ideal research mentor, someone who has the same interests as you, or someone you can actually learn from. Maybe this is a doctor, maybe it's a social science teacher, maybe it's a person who holds their PhD, maybe it's a community member that you know is out there and doing the work, although they might not have, certain credentials. They're out there with the community, and if that's something that interests you, try and reach out to them, see what they're doing, see if you can help them in any way. And this is a great point for me to actually read you the email request that I sent to a bunch of these community leaders and mentors that I thought I could potentially do research with. Here's my actual email request that I sent to the MD that ended up writing my letter of recommendation. It said, "Hi, my name is Camille. I'm currently an undergraduate student who is looking for an internship this upcoming spring 2017. A part of my public health major requires me to find an outcome-driven project that I will later present in a public forum through a poster presentation. My interest in public health and community outreach began in high school with frequent trips abroad to help establish ways of prevention in common illnesses like typhoid fever and bacterial infections. As my collegiate career has progressed, I have focused my experiences in the health education and advocacy sector. This spring, I would like to learn more about maternal, women, and child health, as well as contribute to the research, writing, and organizational skills that I have developed through my academics and volunteer works. So I've attached my resume if you wish to regard some of my background information. I am very interested in speaking with you about a possible spring opportunity. I look forward to talking with you. Regards, Camille." So this was what I submitted, and actually ended up being able to just start out as an intern and then move up to a clinical research coordinator. So just this one cold email that I sent flat out to this MD ended up shaping a lot of my clinical experience as well as exposure to then want to pursue becoming a physician. And so, with that being said, let's talk about some of the different areas in which you can do research. Here you can see social science research, community health research, traditional lab bench work, health education, biomedical engineering, or even helping with the patient experience. I did some research helping a medical school's OBGYN department. It was a teaching hospital where they did have students that were undergrads as well as medical students try and help streamline the EMR, which is the electronic medical record system, logging people on and getting them access to be able to have the online portal to talk to physicians. So, that helped with the patients having an outlet to speak to the doctor instead of having to, call them in the office. So there's different ways in which you can help someone. So another research opportunity that I had was a community health oriented one. I had a fellowship where I looked at food insecurity within the surrounding area of my university. We're technically considered a food desert, so we spoke to different organizations nationally that have tried to combat it using mobile food trucks that would go town to town or to after school settings where, parents would be with their kids to increase the access to healthy, sustainable, community grown food to help stimulate the local economy as well as improve the health of people that reside in that county or reside in that location. So with that experience, I was able to help my own community. I did a little bit of volunteering. I was able to, run data. We had to submit an IRB to talk and publicize the information that we did get from all those national organizations. So there's different ways for you to approach getting experience. Maybe you really like social work, or maybe you really like teaching. Maybe you really like health advocacy, social justice causes. See what you can do within your community. And, if anything, holistically, there has to be a way that it relates to health. So just go forth and try and find some opportunities. And how do you do that? You send cold emails. Or you want to make sure that you are showcasing that you have had past experience. So attach your resume. And even if you haven't had past experience in what they specifically do, you can say that you are interested in doing that and learning about it and being exposed to, the topic at hand. And there you go. You also might have to consider creating your own project and seeing how you fit into their whole ecosystem, whether it's at a hospital or whether it's at an organization. And don't be afraid to do that, because it's through that a lot of people that I've, read personal statements from have gotten these awesome opportunities. There was this one girl who loved photography. She ended up working alongside a plastic surgeon who specialized in a reconstructive surgeon who would help people, for example, that had just gotten a mastectomy, to show the transformation process from start to finish. So the student was able to go in and take photos of these people and created a booklet that was displayed within the waiting room of that physician's office. And there was this cool component where her work was also able to impact lives, and I couldn't even imagine, but a scary situation to be in. It takes a lot of resilience, it takes a lot of faith, a lot of hope, and she was able to connect that sentiment through something that she liked, which was photography. So look and see what you can do to help contribute to some of the social causes or some of the lasting impacts that physicians do want to make. And with that, it might be a great segue into getting a stellar recommendation, because you were able to see how you could help someone else. And if anything, that is one of the key highlights of being a physician. You're able to help people by being a service to others. So with that being said, feel free to like this video and subscribe to my channel for more videos, and I hope to see you soon. Bye now.